this case is quite complex. Third-party consultation, you're consulting the son. It's worth inquiring whereabouts is the dad right now. Asking as well, is a patient aware that the son is talking on his behalf today? When you're asking this question, it's sure that you're thinking about confidentiality, you're
Yeah.
thinking about whether the patient is still able to make decisions. You also want to know whether there's other problem in the faculty. So not just memory loss. When you're talking with your dad, is he able to answer questions? So in a way, assess via the telephone to see how bad is it. The question that you asked were very focused. So you ask question that showed like you're thinking about the safety of the patient, and you ask also about the patient's mood, how his patient's mood is. This is a case where when you're discussing the management, I think you could make it a little bit more patient-centered, because at this point, it was very much doctor-centered. Like you were saying, I will send your dad to the hospital, you get a check there, and then about the explanation a little bit more simple as well. That would have helped in terms of how you're explaining it. If you had to do it again in terms of the explanation, was there anything you would have done differently?
I say to the son, I am concerned, and you are right to be concerned as well. And I think it's appropriate to bring your father in. I'd like to offer an appointment for him to actually come into the surgery, if that's okay with you, and if that's okay with him. What we'd like to do is we'd like to do some basic observations, like checking temperature, like checking pulse, like blood pressure, to make sure, listening to his chest and his urine, to make sure that he doesn't have an infection that might be leading to him being confused. If that is not the case, then we would like to do some tests for checking his memory. Well, how does that sound to you? And if that's the case, then there are options that we can offer, like referral to the memory clinic. What are your thoughts about that?
It's better than the last one, but here I think it's worth verbalizing what's your working diagnosis. So your working diagnosis here was non-pressure hydrocephalus, right?
Yes.
So it's worth telling them this is more of a problem due to the pressure. You did kind of explain it, but I think it's worth actually highlighting that this is different from what the son is worried about. So by making that contrast, then you hone it down with the son. Does that make sense?
Yeah. I just didn't know what questions to ask to actually get to the definition of to get to the diagnosis of normal pressure hydrocephalus, and how would I ask about ataxia? Has he had any falls? Is he wobbly on his feet?
So these are good questions to ask, because that will help you to gather evidence as to non-pressure hydrocephalus. Because you know the history of a short change in the patient's cognitive faculties is actually one of the clue. Because dementia is usually something that's insidious. It usually takes months to years to actually progress, whereas a short history of 1 week, it tells you there's something else could be going on. So in terms of the bladder, you could ask, has there been any accident? Because sometimes they will have a problem with incontinence, which is unusual. In this case, you could actually speak with the patient as well, like see whether if the patient is with the dad, then say, could you put me on loudspeaker so that we can have a chat? So then you can ask a question. I mean, this is a case where I would ideally do it as a face-to-face, because then I will have more information rather than doing it as a telephone. Any further question on this case?
I was thinking if there wasn't any dizziness and it was just a delirium, then we will just examine the patient, urine dip, and maybe just to find out the cause of delirium, isn't it? And then follow up. Yeah.
Well, the thing here is that for a safe assessment, you need to be thinking about the potential diagnosis. Because if you're just thinking about one or two things and you're not thinking about other things, then you're missing a diagnosis. Delirium is something that you're thinking, but delirium itself is not a diagnosis, because there's an underlying cause that's causing a patient to have delirium.
Yeah, then it won't be a good case, because we don't find like normal pressure hydrocephalus in day-to-day clinic. I think it's not very common.
Yeah, it's not very common. I agree completely with you. But there's a lot of cases where you have patients with memory loss.
Yeah.
So when you're having case of memory loss, you're asking these questions, then it shows that you're making a safe assessment. Even though it might come back negative for ataxia or in urinary incontinence, but you're standing out against other people who are not really thinking about that. A GP might not come across it for the whole of their career. But if they do come across it, they know how to actually identify it. When you're showing you have got the skill, then you're more likely to score well. Does that make sense?
Yeah, it does. Yeah. Thank you.
I just used to think it was more of just give options and just listen to what the patient says, but actually thinking about the options you're giving and how it fits into the patient's presentation is actually what makes it really personalized, not just a generic thing that you offer anybody who comes with that symptom. It's actually painting. I mean, yeah. So, and I'm really glad that you've really highlighted the fact that I really need to do more of exploring differential diagnosis. I'm not doing enough. So it's something I have to work on, definitely. So I have to open up my differentials better. I'm really glad. I'm really happy. This is, I mean, I've attended about two other RCA. One was from the deanery. The other one, I just thought I should just get on it and just listen. And I've not felt this way. So this is really good, and I can't wait to get back to start recording. Okay.
That's great. I'm glad that it's now clicking in your mind, because
Yeah.
once you understand the reason we're doing it, it changes everything, because your perspective and the way that you do it completely changes. If you're struggling with the RCA and you believe that you need help, then I'd recommend that you click the link down in the description below to book a free call to see whether we can work together on a one-on-one coaching program. If I think that I can help you, then we can get you on the coaching program. But if I can't help you, then at least you'll get some insights.
So Mr. Wisner, I understand that you're having some memory loss recently. Would you like to explain, or you like to explain to me some of the things that you're...
He'll ask me a question.
I hope you found this video useful. Let me know down in the comment section if you have any questions or any suggestion. Take care, everybody. Bye-bye.